Hi, my name is David Clark, and I'm a member of Ipswich Aware. Ipswich Aware is a collaborative made up of a group of stakeholders in the community who have a common concern around the opioid crisis that is impacting our community today. Some of the stakeholders in our group are police officers, clergy, educators, businessmen, social workers, youth counselors. We have been in existence since March of 2016, so we're starting our fourth year together as a group. And our goal today is to hopefully help you get to know us a little better. I'd like to start by introducing the rest of the panel members. Besides myself, we have Joe Perna, who is the police resource officer at the high school. Jeff Carovallano, the assistant principal of the high school. Chris Bevilacqua, who is the director of the Y. And Amy Epstein, regional prevention director. So we would start now with Amy presenting a prevention presentation.
Hi, my name's Amy Epstein, and I am the Regional Prevention Director. I work out of the Gloucester Health Department, but our region includes all sorts of towns in Cape Ann, as well as Ipswich. We work with Danvers, and our goal is to really focus on preventing issues before they happen, along with interventions along the way. Today I brought a little something to help explain the different levels of prevention. One of our best practices in public health is to really make sure you're working with as many sectors of the community as possible, which is one of the reasons why Ipswich Aware has been so successful. So I'm going to tell you a little story. This is a man. He walks his dog every morning, and there's a lovely river. And every day he walks his dog by this river, and all of a sudden he starts finding these drowning children in the river. He's very concerned. He doesn't know what to do. He pulls them out. He calls the ambulance saves them. Every day this happens. So they decide what they're going to do is they're going to go ahead and just plant an ambulance at the bottom of the river. This is what we call tertiary prevention. This is treatment. This is all different things where we can kind of help after there's already something going on. Eventually, the ambulance kind of, they run out of funds to keep the ambulance there, so they start to think about other solutions. The man with his dog walks up the river a little bit, and he sees that the kids are actually floating down the river before they start drowning at the bottom. So he calls his friend over at Frank's Flotation Devices. Frank comes by with his flotation devices, and he puts himself right here before the kids start drowning and throws them something so that they don't have to be saved by the ambulance. This is what we call secondary prevention. This is things like Narcan, other kinds of interventions where we can kind of prevent stuff from getting worse once things have already progressed. This works for a while, but eventually, Frank has to go back to his flotation device store. He needs to go back and can't live here all the time. So we keep kind of following the river upstream and seeing what else is going on. We discover that there's actually children falling into the river from above. And when we investigate a little further, what we find is there's a group of children playing basketball on a basketball court up on a cliff. Now, right here is where we like to do primary prevention, and that's really a good place to focus with young people. A lot of different things can happen over here at the basketball court to make it so that we are preventing the fall and the drowning and even needing the flotation device in the first place. So some examples where the community could come together is we could get DPW to build a fence. We could get the YMCA to teach basketball lessons so that kids stop missing the ball. We could have police. We could have them looking at the area, coming by, helping the young people understand that to be safe. So there's all sorts of interventions we can do that eventually will help us to prevent having the ambulance. So we have primary, secondary, and tertiary prevention. And these are all different things that we try to do at Ipswich Aware. And we try to use every intervention in the entire scope that we can.
Jeff, might be a good segue in for you working with youth and high school level to to expand on that and what real life things are here in Ipswich.
Yeah, I would say that at the high school, because we have young people there, we definitely do see kids with substance abuse issues, often combined with mental health issues also. And Ipswich Aware has been really important for us to network with all the community resources that are out there to help kids. So it's not just the assistant principal or maybe the counselors at the school trying to help kids, it's the whole community. And the kind of things that we've done with Aware are we've started a really close relationship with the YMCA, and we'd worked with the YMCA in the past, but because of Aware, we have a much more effective, I think, partnership. I've met many different people through SAPC, which I became involved with through Aware, working with the doctors in the community, for example, giving them e-cigarettes for them to show parents at the physicals. We've used Aware to try to help kids get rides to rehab when they couldn't get it through their families. There's just been all these things that have happened from just networking and getting to meet the different community resources. So we at the high school think Aware is really, really important. And we've seen in the last year or so, we've seen an increase in substance abuse among teenagers, mostly vaping and marijuana, and it's a real concern to us. So it's really important that we have all these community groups together to try and help kids.
Joe, as a resource officer, what are you seeing in your daily walk among students?
So obviously, any kind of substance abuse is something that, especially in kids, that we don't want to see happen. So we want to figure out the best ways that we can try to prevent it. So even for me, just as a police officer, it's hard for us to actually get involved in the prevention piece because the majority of our time is spent responding to the calls, whether it's an overdose where we have to, actually use Narcan, or if it's, because people are addicted and there's obviously substances in the community where we have to, enforce laws against, dealing drugs and possessing drugs. So being involved in a group like Ipswich Aware gives us that opportunity to collaborate with the other key players in the community and say, obviously we're involved in the drug problem, but we want to get more involved in preventing the drugs from being in the community, preventing those people from becoming addicted to drugs. So that's really where the key is especially for me, to try to come up with strategies and make them effective to try to prevent drugs from getting into kids' hands. A program like DARE that we've done for a long time, now it's not just about not doing drugs, it's about not making those risky decisions, about better decision making, so you don't get into those risky behaviors that can eventually lead to more destructive behaviors like substance abuse. So there's definitely a lot that we can do as the police, but it's a lot more effective for us to do that if we partner with a group like Ipswich Aware and everybody else that's involved in Ipswich Aware, and really kind of get that message out about our community and everybody in it is extremely important, but we're not immune to an issue like substance abuse.
I guess as a participant in Ipswich Aware, for our organization, it's really nice to be able to work alongside all members of the community and work with people that see the issues, especially around youth, and then be able to kind of communicate back to us how we could be a better resource. And it's been nice to see that around our entire table, right? With all of the people that come in, everyone, so say it's teens and substance abuse issues with teens, everyone at the table in some way is able to say, oh, I can participate in helping address this issue without duplicating efforts, and we all work together really nicely. I think being able to work with Joe and being able to work with Jeff and have them come to us and say, hey, there's some teens that are struggling, they could benefit from some positive alternatives, can the Y provide those? And then us being able to step up and say, absolutely, whether it's through a free membership, whether it's through getting them engaged in a program, helping them be trained to do a job, whatever it is. And I think culturally, at least what I've seen too from interacting in other communities, when you look at a Danvers or a Newburyport that has been addressing this issue from the standpoint of working as an entire community to provide healthy alternatives for kids or positive alternatives, you see it work, but it's a cultural thing. So it's not just the police, the Y, the schools, that kind of thing. It's the businesses. It's everybody saying the same things to the youth to encourage them to engage in positive behaviors. And I think, again, being part of this group, it's really nice to see us be able to do that, because you've got so many different people from the table all working together. And that spreads the message more broadly throughout the community and can get other people involved, even if they aren't a formal member of Ipswich Aware. If they know someone who is a member of Ipswich Aware and they know what we're doing, oh, I can get on board and I can start supporting that in a way that's going to benefit and help solve the problem. Because it's cultural, right? It's a big cultural shift to make.
Yeah, I'd like to highlight a couple of things we're doing with the YMCA that came directly out of our Aware membership. One of them would be we have several kids who have scholarships to go to the Y, and the Y is paying for it. And that's been huge for kids who are at risk for substance abuse, to give themselves something positive and healthy. And we've seen that's been really effective. And we also started the PASS program, and it came out of discussions at Aware, put us in contact with the Y, and also Recovery High School. And the PASS program is Positive Alternatives to School Suspension. And that allows us, when we suspend kids from school, mostly for substance abuse reasons, instead of just sending them at home without supervision, instead they go to a program in Beverly that's hosted at the YMCA's after-school building at the McPherson Center, where the kids are given academic support and tutoring, and also counseling. And also the counselors are determined if these kids have a substance abuse issue that needs further treatment outside of like 1 or 2 days at the program. We found that's been really effective also, and that's becoming a kind of regional model, and we expect to see that expanding. It's a much more positive thing to do with a student who's got in trouble with substances in school, rather than just exclude them from school or actually getting them services.
The other thing that's been nice is we've been able to collaborate with the police and Joe, and in the summer we offer a free summer camp for kids, and it's a nice combination of I think it's all types of youth from all cross sections, but the goal is to get them all participating in activities together to break down any kind of stigmas, because that's important. And I think, and it's also an opportunity for the participants, the youth, to see what our public services do in town, so police, fire, harbor masters, those kinds of things, but also get to know them and see them as an ally rather than somebody that's just come in to get them in trouble, or someone that they only see when they get in trouble. So that's been really nice. I mean, that program that you lead I think it's great, and I think it worked really well. We're looking forward to it again this summer.
Right, and that definitely points to the collaboration piece, because we'd love to run our own summer camp, but we're a police department. We don't have the facilities, we don't have the staff that work with youth on a constant basis. So be able to collaborate with you and the Y and have the Y host us is great. So for us to provide a program like that, that's a positive alternative, something fun for the kids to do. But yeah, that really is the key piece. Is for us is to give them an opportunity to see us as real people, not the ones who just enforce the laws and arrest people, but that we're out there and that we want to help, constantly. That's our job, is to help, but that we also want them to trust us and be familiar with us, so that, hey, if they are having an issue, if one of those kids at the campus say, you know what, even if it's my parent has an issue at home, or I have an issue, can you help me? And that's the ultimate goal. Yeah, and there's so many other camps in the community, right, that can also play a role and be a positive support of these kids. I don't think a lot of people understand that just by giving a child a camp experience in the summer, that's a positive alternative to something else they could be doing. Getting them involved in a CIT program, a counselor and training program, whatever it is. And there's so many great camps in the Ipswich area that can be a part of supporting. So again, I think as we, for us, as we talk about how do we expand the support for youth, it's about getting other communities involved, other community members involved that run summer programs, or even local businesses, if they have internships for kids in the summer, that kind of thing. That's a healthy alternative, and it can be really beneficial in supporting these kids.
We talked about a lot of the trickle down from the regional collaborative that we're part of, and just recently there was a program that you did as a police officer with a sticker shock. I don't know if you want to just expand on that a little bit. Again, this is actually a program that I participated in years ago in a previous job, and sticker shock has been around for a long time, but we never had the
funding or the kind of network to pull it all together. So to have SAPSI involved to say, hey, we're applying for this money to use it regionally, and do you want to be involved? I was all on board. You know, sticker shock is a prevention strategy targeting those adults who buy alcohol legally, but then give it to minors illegally. I mean, a simple concept, right? We shouldn't be doing that. But it happens all the time. Obviously, kids are getting the alcohol somewhere. We as police have to respond to the parties and do our jobs and enforce the laws. You know, but we should be able to prevent this. We should be able to get inside adults' heads and say, hey, this is wrong. We worked with Rotary Interact Club, which is their youth group that works out of the high school. They were all on board to help us out, and we went in with a group of youth, and we put warning labels that said, you know, what the penalties are for providing alcohol to youth, and put them on as many of the multi-packs, 30-packs cases, 6-packs of alcohol in the liquor stores that we could do. It's also a great collaboration with the businesses in town. So when we approached, not just myself, but the youth, and approached the businesses to participate in this program, every single alcohol retailer in town agreed to do it. And so now every single alcohol retailer in our town has those warning labels on their products.
Yeah. Amy, how does that compare with the other towns that are part of the regional?
So this is an effort that has been participated through the whole region, but Ipswich is absolutely the only town that has 100% participation in their sticker shock program. And but what's great is that folks who might see the project in Ipswich might go, you know, a young person who might be buying alcohol or planning to buy alcohol for someone in Ipswich might see the signs and then go to Beverly and see the signs and then go to Gloucester and see the signs. So working on this regional level is really helpful. SAPSI, which we keep referring to, stands for the Substance Abuse Prevention Collaborative, and it comes from a state-funded grant that is able to help us share all these resources so that together we can, as a region, make more of an impact. But Ipswich has been participating on a really high level, and I think that Ipswich Aware is a big piece of that. And to have, you know, really engaged players coming to participate on a regional level as well, and then bringing that back to the Ipswich group has been, I think, invaluable to the process and to the progress that the group has made as well.
That's awesome. Thank you. So we spent a lot of time on youth prevention education in a discussion. There really are three goals that we have as Ipswich Aware. One is youth prevention education. The second is community education. And third is reducing the stigma of substance use disorder. And so maybe we can move to talk a little bit about what we're doing in the community as a whole, as Ipswich Aware.
We've had a couple of ongoing, or I guess long-standing events that we've done in the community to bring awareness to the community and educate. I think the first is the Vigil, right? So
that's right.
I mean, and
this will be our third year coming up.
Yeah, and I mean, you were the one that kind of spearheaded getting that started, and I guess maybe talking a little bit about where that came from and what we've done so
well,
far.
The Vigil itself really, I first experienced it in Gloucester, and from there we started our own here once we formed our Ipswich Aware group, and I think the first year there might have been 6 people there, all from Ipswich Aware. Nobody really stopped by. It was just a little table at the bottom of Town Hill. Last year we moved to what they call Middle Green over near the War Memorial, and we had probably 30 or so people there. We had a couple of speakers. One young lady talked about her recovery. One mom talked about losing her daughter to substance use disorder and the impact of that on families. And we had music, and it was well attended. And my hope is that as we prepare for May 23rd of this year, that we'll have more participants in the Vigil itself.
I think just the growth of the participation kind of speaks to the fact that it's working to help educate people in the community. Because right, that's the goal of the Vigil, is to honor people that have passed as a result of addiction, but then also support folks that are struggling. And I think, again, the fact that we went from 6 to 30 was great.
And that also works to reduce stigma.
Absolutely.
Just by people being willing to come out and in a public place and participate in a vigil like this.
Yeah.
There's also something else we've been doing for a couple of years, and we'll be coming up the end of April. Touch a Truck and Drug Take Back. I don't know if you want to.
Sure. So Drug Take Back Day is a DEA program that they promote nationally and host collection sites. So we're at the police department, we always have a collection bin going for unused and unwanted prescriptions. But the DEA has taken the lead on this, knowing that there's a lot of unused prescription drugs and medications that either just get disposed of into landfills, which is horrible for our groundwater, but the bigger concern is that they sit in medicine cabinets and unfortunately end up getting used and abused by people who shouldn't be taking them. So obviously for us who are concerned about the youth in our community, if their parents had a surgery and have painkillers in their medicine cabinets and don't need it anymore, unfortunately that poses a risk that maybe somebody's going to make a bad decision, that I could try that medication and see what it does and see how it feels, and unfortunately it could lead to an addiction or even worse, an overdose.
I feel like the amount that has been collected has increased year over year. Right?
Yeah, we have an ongoing bin where they can be dropped off, but I think since we host an event that's out in the community, we do the Touch a Truck event along with it to make it more of a family event, so people can bring those medications and drop them off, but also bring their kids to come take a look at at our police boat, at a fire truck, at a crane, a DPW dump truck, and have fun with it. So I think that hopefully that's definitely increased the amount that we've had dropped off, and subsequently reduce the amount of unused medications that we have out there in the community that pose a risk.
So it makes it family friendly and not a stigma thing, where people can come, they can bring their drugs, the kids get to touch a truck. There's also a couple of tables, Learn to Cope being one support group. Ipswich Aware is there. There have been other organizations like Action that have participated in the past. And yet they may also be able to pick up some information that they normally wouldn't just walk in and grab, because it's blended with a lot of other pieces. And I think that's an important piece to how we communicate and how we educate the community.
I think another big important piece for community education is the Dr. Pody presentations that we've had.
That's right.
That have,
Right, which is funded by Aware.
Yeah.
Yep. Yeah, I can talk a little bit about that. We had Dr. Ruth Pody, who's a nationally recognized expert on how drug use impacts adolescent brains. And in the past, we'd had a lot of presenters come in to talk to kids about substance abuse, and it really didn't resonate that much with the kids, but Dr. Pody really did. It was a youth presentation. She talked to the teachers and then talked to the parents as well. And it really started a discussion about really why, as an adolescent, you shouldn't be drinking or using marijuana or other drugs because of the impact it has, and how the impact is different on an adolescent brain than on an adult brain. And I think that was one of the more effective things we've done to try to curb youth substance use. Yeah. Something else we can talk about for youth is that Aware helped facilitate the YRBS survey, which we hadn't done in a number of years, and helped help pay for it. And the YRBS survey is the Youth Risk Behavior Survey, which is a nationwide youth risk survey. It includes information about substance use, student mental health, bullying, risky sexual behavior, all those kind of things that can affect a student's well-being. And we have all that data now, and we're going to be, also with Aware's help, we're going to be having an awareness night at the YMCA on May 1st from 5 to 8 p.m. And we're going to have all these different community groups, including Aware and SAPSI and the police, I believe Leahy Health, some other groups are going to be there, and we're going to show the parents the data from the survey and then show what the community is doing to try to help these kids. And again, that all came from our membership in Ipswich Aware.
Yeah. And also going to do in plain sight. I don't know if you mentioned
That's
that as part of that. Do you want to touch on that, Joe?
Sure. So as part of that event, we as the police department will take essentially props, create a mock bedroom, and disperse things throughout that bedroom, and invite parents to walk through to get an idea of what they should be looking for to determine whether or not maybe their kids are experimenting with drugs or actually have an issue. So we'll have different paraphernalia items, and then things that indicate the growing trends of what kind of substances are misused and abused, and hopefully open their eyes a little bit to the problem that exists and the cues and clues to look for about whether or not their youth has a problem.
The mock-up bedroom, the hidden in plain sight, is really geared for parents, not children.
Sure, yeah, it's definitely a parent event. We want parents to come in and take their time and go through it. We'll also be there as police officers to kind of help them and point out the things that they might not even be seeing.
This has been done in a few other communities also, and has been well received and a lot of positive feedback. And Amy has mentioned a couple times in our discussions that it can very easily turn into a panic situation for parents. So it's important to have those discussions with the police officers that will be there also.
Early intervention and having those conversations can be really, really effective. So even if you're finding concerning things, it doesn't mean that you're down a terrible path. It means now it's time to go to the YMCA and get involved and do some other things.
I think bringing groups like Learn to Cope, and involving them in the conversation, and letting people know that those groups exist, and there are places to go and talk about and get support for addiction and substance use, I think is really important. I don't know if you want to talk a little bit about that, or.
Well, Learn to Cope is for parents. It is a support group. It's been very effective. There's 25 or 26 chapters across Massachusetts that meet on a weekly basis, and it's been very helpful with parents becoming educated around addiction and substance use disorder within their home. It's a safe place. It's a caring place, and it's helped a lot of parents over a number of years.
I think another thing that we've done, the group Ipswich, to help reduce stigma that I think has been pretty effective, but it's also been an educational piece, is the community forum that we held, where we basically invited folks from the community. I think we probably had about 40 to 45 people attend.
That's right.
From all different demographics, to let them know, kind of like in this format, what we do, and then ask them what else they see in the community as issues around substance abuse. And I think just having all the people in the room talking about it and acknowledging it and kind of working together to come up with solutions, I think that's a pretty important step in reducing stigma. To do more of that, we have plans to do more of that, and I think that'll be an important piece as we move ahead, and especially in engaging the community, as we talked about, like kind of shifting things culturally to make sure that we're all working together to support folks at all stages of their lives.
I think looking to the future, and I think we're getting close to having to wrap up, but two things that hopefully will be becoming more real is our work with the medical community here in Ipswich, trying to get them good information to be able to pass out to their patients, and also how to have that conversation with the parents and the patient if they're children along the way. And the other thing is trying to get businesses in town involved with through posters or some other way to bring them in and help them be part of the education process.
If people are interested in learning more about us or getting engaged, they can find us at our website,
ipswichaware.org.
Folks can not only contact us, but there's a list of resources to help people that are struggling with substance abuse or just looking for resources around substance abuse prevention. So we encourage anybody in the community to use that as a resource. Please go check out the website, and there's also a Facebook page. And if you're interested in becoming more involved, please reach out to us.
Excellent. Well, thank you all.
Thank you.
It's time.
Thank you.
It's been great.
Thanks for everything you do to help the kids in the community.
It's all good. Good group.